It's about 7:16. Aren't we live yet?
Yes, we are live. We can start.
We're live. We'll start. Any confirmation is there?
Yes, we are live.
Okay. So, good evening and hello, dear NEET PG aspirants. I'm Dr. Syed Samil Hossaini, a consultant physician right here from Mysore. And me and my friends are here with our Chief Counselor 2024. We have Dr. Sarthak, who is an ID physician. So, let us start without wasting any time. Let us start discussing about the issue at hand. Can you just tell me what are the new things that is going to happen in this 2024 and how is it different from
Find the better rankers. So all those things we'll be discussing today. I think we have a lot of things to discuss. We have a lot of topics. I think Dr. Sami will give a timeline, or we will tell you about what are the things we are going to discuss today. Over to you, Dr. Sami.
Yeah, thank you so much, Dr. Wasim. So today's the discussion is mainly about the NEET 2024 counseling timeline, and I think that will be handled by our Chief Counselor Kumar Madhavji. Over to you, Madhavji.
Yeah. Hi. First of all, congratulations to all those NEET PG aspirants like who have cleared their NEET PG exam. So we know like this year lots of problem faced by the student, and because of delay in this thing NEET PG exam, and there were like lots of confusion regarding this normalization. So whatever happened, we can't go back and change. But as of now, we got some rank. Based on that rank, we have to focus on the counseling, and we have to get some. We have to get placed in some good institute or good branch by attending the counseling. So according to me, the tentative date for counseling, that see, there are two types of counseling. First, All India Round 1 counseling. So according to me, All India Round 1 counseling might start from second week of September, in between second week of September, and it might end till, it might go up to fourth week of September. And regarding the state counseling round 1, so state counseling will start only after completion of All India round 1 counseling. So after fourth week of September, and it might go up to first week of October. And the candidate, they may take a note here, All India that state counseling registration, they might start earlier as well. So you need to be updated with the dates. You must go through the counseling website of particular state. So this is the round 1 timeline for All India counseling. And now, now, I would introduce Dr. Wasim sir, and he'll take the next details regarding the trending branch.
Yeah, thank you, Madhavji. See, actually, the first thing that we have to keep in mind after getting a rank is like when you start your PG preparation, like NEET PG preparation, you must have started with a goal. Like after you finish your 4.5 years of your MBBS and 1 year of internship, throughout your MBBS, and once you go through all the departments in your internship, you must have uh, had a dream branch. That is what I call a dream branch. Uh, so that branch you must have started your preparation keeping in mind that yes, I want to become this. So few people will be having a dream like I want to become a surgeon. Like they start their preparation aiming that yes, I want to become a surgeon. Few people will be like I want to become a cardiologist. So for that they first have to become either a general medicine, a internal medicine specialist, and then they will go into DM cardiology. So that kind of thing, they will have that zeal and they would have started the preparation. So then now what is happening is, if your rank is good, so if you have got a very good rank, yes, your dream is achievable and you are going to get that desired branch in that place, and then you will be going there. What if you are in between? What if the rank, you are not clearly able to make out whether that rank will fetch you that dream branch or not? So in that situation, what I would always advise students is, see, basically during internship, you must have got an idea. You must have seen all the departments. You must have seen general medicine, general surgery, orthopedics, ENT, ophthalmology, radiology, pediatrics, and everything. So one thing that must have uh, uh, gave you that adrenaline rush in you. Like for example, few students when they put the knife on a patient, they will during internship they must have performed few amputations, toe amputations, few suturing assistants in the surgery center. They must have got an adrenaline rush. Yes, this thing is exciting me, and I am ready to do this all my life long. So that kind of person I call it surgical person. So that type of students, they are surgical type of students. And few students when they work during their internship, they go to pediatric ward and they must. This is what I want to do. So in this category, what I usually advise is always put option A, option B, and option C as well. See, in life, you should always have your life doesn't work only with plan A. You should also work with plan A, plan B. You should always have a plan B as well. So I always advise the students to have branch A, branch B, and branch C as well in their uh, mind. Okay, so usually that's how I have divided right now. So in the branches there will be surgical branches and medical branches. Like we have medical specialty consultants here. We have Dr. Abhinav, who is a pediatrician. We have Dr. Shrikant, who is a radiologist. We have Dr. Sarthak, who is an infectious disease specialist, and we have Dr. Shweta as well. She is a radiation oncologist, internal medicine. He is a consultant physician. So here we have a surgeon. So here only you can see one person is from surgical background and a medicine side. So basically, and always make sure you are going to stay with that branch for your whole lifetime. So that branch is going to stay with you. So always make sure, uh, keep down, pen down what and all your interests are, and later in this session we'll be discussing what and all the factors you have to take into picture. So always choosing a branch initially, the first thing is it will be an individualized. See, I cannot tell by looking a face of a person that yes, you are going to become a radiologist, you are going to become a pediatrician. No. So they have to sit down and they have to pen down few things, and they have to go into their experiences and look at themselves and see, yes, so this is what has excited me and this is what I want. So I think
Okay.
we'll be keeping this discussion on. Yeah, over to you, Dr. Sami.
Thank you so much, Wasim sir, for that elaborate and insightful information for us. And since everybody is familiar with most of the broad spectrum branches like medicine and surgery, I would like Dr. Sarthak to put some light on trending branches. Over to you, Dr. Sarthak.
Hi everyone, I'm Dr. Sarthak Gupta, currently a GR Medicine ID at Ames Delhi. So yes, firstly, whoever has achieved a great rank or whatever they wished, congratulations to all of them, because this NEET PD journey was really tough. So many postponements, preponements, and finally you have got a good rank. And all that matters is ki, because abhi you should be feeling much lost or hopeless ki yaar ab rank nahi aaya, ab kya kare, because this rank is only important till getting into your dream branch or till getting into your residency. After entering into your residency, about your rank, and nobody will ask you 6 months down the line or 3 years down the line, what was your rank. So your focus should be on ki how I am going to get into residency while using this rank. Up to use this rank effectively, what you have to do is you have to firstly think कि भाई कौन सी branch है, तो what are the factors which you should consider, we will be discussing. But if I talk about the trending branches, so trending 5 branches, or I can say 6 branches are there which most of the people usually take. Those 6 branches are medicine, radio, derma, ortho, pediatrics, if I have to be precise. Yes, these 5, or obs gynae, these are 6 branches we usually people take. But the thing is, there are some people who like to do surgery, or who, as Wasim sir mentioned, who get a kick while doing some surgical procedure. So if you are that sort of person, then you must go for a surgical branch. But the thing is, what I heard from what I have heard from various people and what I consider true myself is कि surgeon usually knows that he wants to become a surgeon. So if you are not sure whether you want to take a medicinal branch or surgical branch, you should go for a medicinal branch. Because if somebody wants to take surgery, he must be very sure at this point of time that I want to take a surgery. Or the thing is ki, if you are not having an option of selecting a branch for yourself, if your rank is not that good, then it is fine to be a surgeon. But if you are in a position to select a branch for yourself, then you should consider medicinal branches if you did not want to be a surgeon at this point of time. Okay, so if I talk about trending branches, then generally why people take radio or why people take derma is just because of a good work life balance. So if you want a good work life balance, if you want it, नहीं यार अभी तक बहुत पढ़ लिया, इतना इतना यू नीट यूजी वहां पे पढ़ लिया, फिर पीजी की तैयारी किया, इतने पोस्टपोनमेंट, अब उसके बाद में अब और पढ़ाई नहीं करनी, और थोड़ा लाइफ में थोड़ा वो चाहिए कि जो खुद के लिए टाइम चाहिए और सारी एक्टिविटीज के टाइम चाहिए, तो यू शुड कंसिडर ब्रांचेस लाइक डर्मा or radio. Also upcoming branch is nuclear medicine, which usually students take because they want a good work life balance. So in trending branches, the thing is, if you want a good work life balance, then you should opt radio or derma. And in other branches, if you don't want to pursue DM, if you are specifically a female and you are not you don't want to give another entrance exam, then obs-gyne is a good branch because it is mostly a terminal branch and you can end up your academic career just while doing PG itself. But if you are someone who is good at making diagnosis, or who wants to deal with a whole lot of symptoms, a whole lot of medicine, whatever you have studied till now, then medicine is a good option for you. So you should consider. And if you like to deal with children, then pediatrics. So this was about trending branches. There are other branches also. In other branches, surgery, ENT, optha, we will be discussing what factors you should consider. Also, I heard a thing that it is very important to to think about your branch rather than the college. So somebody mentioned this, and I heard it somewhere that when you are marrying someone, so the venue is the college, and the person you are marrying is your branch. So basically, that branch is going to stay with you for rest of your life. So you have to think or choose very wisely before taking any decision. Okay.
Okay,
So
thank
this
you.
was
Thank you, Dr.
Thank you so much, Dr. Sarthak, that he has raised a very important analogy about a wife and a dream branch and a venue. So I'm going to ask Dr. Shrikant, because he's a radiologist. I want to ask the importance of infrastructure to the colleges that we will be joining. How important is infrastructure in the branches with nuclear medicine or radiation oncology or radiology? Because these branches need an high-tech equipments. So over to you, Dr. Shrikant. Dr. Shrikant, I think your voice is mute.
First of all, congratulations to all NEET PG aspirants. You cracked the already NEET PG now. You have a good rank in your hand. Now it's time to choose the branch for a whole life. So I am now a resident of radiology in third year now. I'm doing my residency in basically I have done my UG from Maharashtra. Now, as the sir asked me the question of the branch of the radiology and all the technology and all, like the first of all, the institution सब इंस्टीट्यूशन में अभी देखने के लिए सबसे पहला अगर रेडियोलॉजी देखने हैं, रेडियोलॉजी न्यूक्लियर मेडिसिन, तो फर्स्ट ऑफ ऑल अपन मशीन्स कौन कौन से है हर कॉलेज में, ये सबसे पहले इंपॉर्टेंट होता है, जैसे कि CT, MRI, USG and X-ray machines. Most of the colleges will have the X-ray machines. There is no problem with the X-ray machine because of the medical college. They will have already the X-ray machines and all, and USG also they will have. The problem with the comes with the most generally MRI machines and the CT scan. The generally private colleges, as of I has seen now, most of the private colleges they have maintained the CT properly. CT in each college, private college, CT will be there. But the problem with the MRI scans are there. There are many types of the MRI scans, like 1.5 Tesla, 3 Tesla. The equipments are, as you go in the higher cities and higher good colleges, like deemed colleges are good there. In there, that colleges you will get the 3 Tesla MRI, 1.5 Tesla MRI. But the other colleges you might not get all the details of the all detail equipments of the for the radiology. So you have to choose likewise. So you have to search for the institution. You have to search the details, which machines they have, which Tesla they have for MRI scan. The PET scan is there or not. Mammography scan is there or not. These all things will not be there in every college. Like every government college, many government colleges also don't have the MRI scan as of now in India. At least in Maharashtra, as I know, in Karnataka also, not all colleges have MRI. They have attached with the other colleges, government hospitals and colleges for the MRI scans. Okay, in Maharashtra, so all government colleges don't have the MRI scans. These are the all these things we have to see for choosing the radiology branch as a radiology and other as a regular medicine and all things. These are the main things. Over to you, sir. Now, for Said.
Okay, thank you so much, Dr. Shrikant. That was very insightful. And I want to actually go about asking this question to Dr. Abhinav because I've got a lot from the chat box and all the students texting me. How is it important for a broad specialty like pediatrics or medicine or surgery to choose between a private institute and a government institute? So, if you can please shed some light on this, Dr. Abhinav.
Yes, yes. See, many government institute for a broad specialty, like pediatrics medicine, we have a huge inflow of patients in government institute. So you have a free hand to manage your patients at your level. In private institutes, the flow is different from institute to institute. So if you do broad specialty like medicine, pediatrics from government setup, you will be more confident after completing 3 years in managing common emergency situations and common OPD situations.
Okay, thank you so much, Dr. Abhinav, for that insightful thoughts. Next, see, these are the basic modalities on which a student thinks upon when he need to know about counseling as well. So, I want to hear from Dr. Madhavji about the counseling rule and its eligibility criteria. Can you shed some light on it, Madhavji?
Yes, yes, Dr. Sayyed. See, actually, counseling rule means there is like no change in this year counseling rule. Counseling rule is almost same as last year. So there are two types of counseling, as I told earlier: All India counseling and state counseling. So under All India counseling, the AIQ 50% government quota seat used to come. Central universities such as BHU, AMU, Delhi University, IPU, etc. used to come. And other than this, DNB and NBE Diploma seat used to come, and deemed university. So these like 4 to 5 type of seat that counseling will be conducted by MCC, and MCC means Medical Counseling Committee. And these all India counselings are domicile free, and all need qualified candidate they can apply for MCC counseling. And deemed university and the private DNB Institute of this All India Counseling, they are category free seat, and there is no reservation in this kind of seat. And there are few deemed university where bond is applicable, and in maximum private, not in maximum, in all private DNB Institute, there is no bond. So these bond and stipend details will conduct in next session. So if we'll talk about state counseling, then state counseling, the remaining 50% government quota seat of that state colleges, which will be conducted by the particular or individual state counseling authority. And the 100% seat of the state private colleges counseling will be conducted by the particular state counseling authority. And there are two types of states: open state and closed state. So what is the meaning of open state? Open state are those states which allows other state candidate to participate for their state private colleges. For government colleges, only local candidate, whoever has done their UG from same state or is the domicile candidate of that state student only can participate for a government seat. But for private seat, for open state, other state candidate can also participate for open seat, management seat or NRI seat. And the closed state means closed states are those states for which they don't allow other state candidates to participate for their open seat. And there are only there are few states which are closed state, and the states are Maharashtra, Gujarat, Kerala. So these are the closed states. They won't allow other state candidates to participate for their open seat. But Maharashtra, they allow other state candidates to participate for their management or NRI seat. And other than this, Madhya Pradesh is a kind of special state which don't allow other state candidate in round 1, but in round 2 or round 3 they used to allow other state candidate, but the first priority will be given to the local candidate. And if they are not opting for some seat, then those seats will be given to the other state candidate. And the state counseling will be conducted by the individual state counseling authorities, and the candidate whoever has done their UG from that state, or else the candidate who are domicile of that state, they are only eligible to participate for government quota seat. And the reservation for other state candidate whoever has done their UG from some different state and they want to claim for reservation, so it's not possible for that state counseling. They can claim reservation for all India quota, but not for that same state. Only domicile only domicile candidate of that particular state can only claim for the reservation of some particular categories. So this is the basic counseling rule and eligibility.
Okay, thank you, Madaji. So moving to the clarity of today's discussion, you will see once again the important counseling tentative timeline, and more importantly, the PG 2024 branch-wise and category-wise probable rank shifts. Because much of the people will be anticipating whether for this rank, and compared to the last year, how much shift or positiveness or how much decrease in this seat they can expect. The team of NEET Predictor has made a beautiful chart which can be helpful for them in this counseling process. Followed by that, we will have about details on government colleges, DNB Institute and NBE Diploma Institutes and their expected cutoffs. Then the trending batch once again. Then we will go about how to choose the dream branch, especially what are the parameters we want to take into consideration to find the dream branch. Then inside the dream branch, how to choose the perfect institute based on multiple parameters. Then we will see the final rule on eligibility things. Already we have discussed, then we will go into the slides. So over to you, Madhavji, for the counseling timeline.
So already I told that round 1 all India counseling, it might start from second week or after second week of September, and it might end around 4th week or end of the September. And the state round 1 counseling will start only after completion of all India round 1 counseling. And it might start around 4th week of September and it might end around 1st or 2nd week of October. And candidate can take a note that the state counseling registration process, they might start anytime immediately after the announcement of all India counseling date. But the allotment process, the seat allotment process or choice filling process will only start after we did some analysis and we made a expected cutoff list of government medical college through all India quota, and almost same for government medical college, almost same cutoff will be through state quota apart from few states. So if you see for radiology, then we are expecting for open category we are expecting around 5,000 all India rank. So it might close below 5,000 rank. So candidate, they can take a screenshot of this. If their rank is below this, then they are safe. If above this rank, under their category, then you must need to keep some backup. So for radiology open, below 5K, for OBC 8 to 9K, for EWS 5.5K, for SC 14K around, for ST below 25K. For dermatology open category 4,600 to 5,000. For OBC 10K or below 10K, for EWS 7.5K, for SC 25K, and for ST 40K. And if we'll talk about the general medicine, then for general medicine, if candidate is having rank below 6.9K, then only they can expect a government seat. And whatever the list we made, this list, this allotment list is still straight on. We are not discussing for special stray round because special stray round is luck based. So if some seats are vacant, then only you can get. So better to try to get a seat before stay on or till stay on. And for OBGY general category 13.5 to 14K, for pediatrics 12K around, for orthopedics below 16K, for general surgery below 18K, for ophthalmology 26K, for ENT 28K, for anesthesia 32K, for TB and chest respiratory medicine 14 to 15K or below that, for emergency medicine 17 to 18K. So those candidates whoever are having rank below this, they can only get those seats.
I would like to request Dr. Sridhar to put the slides back so that the students can look at that whatever Dr. Madhavji has right now told, the expected cutoffs and all, so that once the students will get some time to look at that and they can take a screenshot of that. Yeah, Madhavji, over to you.
So we have the cutoff here. So next we will see like what percentage of students will be joining in the round 1, round 2, and as well as what will happen in the round 3.
Few private DNB institutes have very excellent radiological interventions. I have personally seen them. So they do have interventional radiology departments as well, where they get an extensive exposure. So which is not there in most of the government medical colleges and even few private medical colleges. That thing. And after this, when people are getting aware of DNB as well, see, like Madhavji has pointed out one point. So in private DNB, you don't have a bond. In the further sessions, we will be discussing about that thing as well. So this thing is here. So when you select DNB college, actually, see, you can see the cutoff. Previously, after MDMS cutoff, DNB cutoffs were a bit higher. Previously, in few branches, I have seen that in radiology also, few DNB seats have gone far higher up. Few top rankers have taken MD radiology and MD pediatrics, MD general medicine. Few people have taken DNB radiology, DNB medicine, and DNB OBG, DNB general surgery in few top institutes, and later rankers took MDMS. So, government institute or a private institute, we'll keep discussing that. I think this is a clear insight about it. Keep the branch in mind, not the degree, whether it is MD, MS, or DNB. Over to you, Dr. Sridhar.
Yeah, thank you, Dr. Hossain. So now we will see about the subcomponents to consider while shortlisting the colleges. Dr. Sayed, are you there online?
Thank you so much, Dr. Sridhar. Regarding the colleges, from like Dr. Sheikh Mohammed Wasim sir told that we don't have to see about ND, DNB. We just have to focus on the branches. I would also like to say that the branch is primary importance, and then comes the institute that you're doing it in. I usually classify the institutes majorly into government central institutes, government peripheral institutes, DNB central, private central institutes, private peripheral institutes, and in that MDMS comes into play. So just to make a broad spectrum analogy, a central institute, let's say central institute in the sense metro cities. Okay, MD college or MS college in a central city has of a greater value because many you will have a lot of hands-on, many patients will pour in. Okay, especially cities like Delhi, Mumbai, Chennai, Bangalore, Kolkata. These areas will have a lot of exposure. Next, I always ask them to take DNB in central institutes. Institutes in the sense same again into these hospitals concerning in Delhi, Chennai, Hyderabad, Kolkata, in these areas. And then I would ask them to prefer DNB in peripheral institutes. Let's say it's a two-tier city, like there's Mysore. It's a two-tier city. Apart from that, there is in two tier cities. I would prefer DNB better because the one thing is the patient inflow is better and the infrastructure is also better in DNB because it is handled by hospitals and not medical colleges. Secondly, I would ask them to go to MD peripheral institutes. MD peripheral institutes, comparatively, they are still growing and the infrastructure is comparatively less and the postings that you get are also a little bit how can I put it in a very diplomatic way that they're not as suited for a person to learn exactly what they want. Okay, so this is how I put in a broad specialty.
Thank you.
So over
Thank
to
you,
you,
Dr.
Dr. Sri.
Now we'll exactly see what are the parameters they should see while shortlisting. Dr. Wasim, sir, or you?
Yeah, Dr. Shri. Yeah. See, actually, here you can see on the screen, we have made a few subcomponents to consider while shortlisting the thing. So first you have selected the branch, and then you have also kept in the mind. Now you have come to a picture like whether it's going to be a surgical branch or a medical branch. See, before that, I usually tell students that in post graduation you have clinical post graduation and non-clinical post graduation. So we do have other non-clinical postgraduate seats as well. Like I would like to emerging branches and work-life balance and all those things. It's absolutely correct. And I would like to say a few things like Dr. Sarthak has told about emerging branches. See, a general surgeon cannot sit at home. It's an emergency branch. Any time of the day, if a call comes, there is a patient, you have to make time. General medicine, you have to run. Emergency case can come at any point of time. Anesthesia, anytime you can get a call, a patient needs anesthesia, intubation, or ICU, something else. Pediatrics, a patient can go bad any point of time, you have to run. Okay, and few other specialties like radiologists, I have seen radiologists also working 24/7. I have seen few radiologists exclusively, they do ultrasound, CTs all the around 24/7, they will be available as well. So that there also things go. And then I have seen ENT specialists working night as well, ophthalmologists. So there is emergency in everything. Okay, it's not something like there is no emergency. If you don't want emergency, you can directly sit down non-clinical, aram, so you can sit, no emergency, nothing. And few branches are there, a few non-clinical branches and few subclinical branches, that's fine. uh, Thing is, after you have selected your branch, now when subcomponents you are considering while shortlisting, see whether it is a government institute or a private, any time if you are getting, prefer that. Why I am telling is, the things that matter most are the patient exposure. It's very very important. So whatever you are going to learn in the 3 years of your post graduation, you are going to master that. You are going to build something. When the uh, foundation is strong, you can build even a one floor building, or you can build a huge skyscraper as well. So the base should be very very strong. So usually in government institutes, what do happen is, in core surgical branches or core medical branches, there will be a lot of, in surgical branches, those who are opting or those who are keeping in mind, I want to become a surgeon or want to opt surgical branches, I would tell, prefer government institutes first, where you will be having a better hands-on, because volume will be more duties and all those things. And then comes into picture private institutes. In private institutes, you do have very premier private medical colleges, like to name few, like Manipal and all other premier institutes, and few state institutes premier medical colleges are also there. We do, Dr. Madhavji, all the data, and we all are here, we are here. And in private institutes also, few DNB institutes are very very good. And you need to, okay, you need to have a clear cut. See, whenever I say someone to take a branch, I would always tell them, go to that college, see, and all those things. But it's highly fairly impossible to go and see all the options in your list. You must have shortlisted some 1,000 options, or maybe 500 to 600 options. You cannot go and visit every option, right? So that's where a proper counseling guidance comes into picture, where we have all the data. We have personally been there, we have been in touch with all the residents there, we know which we have counseled, have joined there, and they give inputs to us, and we have also seen them in person. So that things come into picture. And bond, very very important. See, once you finish your post graduation, you are a specialist now. It depends, now you have to come, you want to come out and start your practice, you do something and all. But there, if there's a bond in that particular institute, in that particular state, you are stuck there for another 1 or 2 or 3 years, and you are stuck with some bond amount. If you don't pay that amount, you are not out of that institute. And stipend is very, very important. You have already crossed your I think almost most of the people must have crossed 25 plus, and all must have earned something in their internship. They must have seen that. And post internship also, few people must have been doing some JR-ships and must have studied. So in this period, having a thing when you are doing your post graduation. So we do have that data as well. Government institutes, you do get stipend. DNB institutes, yes, you do get stipend. And few private medical colleges also you get good stipend. Usually government has made sure that stipend should be given to PG residents, but we do have data where stipend is good, and if stipend is also one of your criteria, it is very, very important. And then bed count, usually in government colleges it doesn't come into picture, only in DNB colleges, because a lot of your DNB from an institute less than 100 bed, okay, less than 100 bed, it's like you have to do 2 years of extra senior residency to be equal to MDMS. So that rule was there before. Now it is done. It is removed. Now the rule is less than 500, more than 500. That's it. If a institute use more than 500 beds, DNB, it's usually it is MCA recognized, and you don't have to do any extra senior residency in MDMS in respect of academic qualification, or you can say academic picture. So if you want to go into a medical college as an assistant professor, you have done a DNB from an institute more than 500 beds. That's it. You can directly enter, directly go out, do 1 year of senior residency, and become an assistant professor on par with your MDMS people. But in case you have done a DNB from an institute less, you must do 1 year SRship more than your counterparts of MDMS. Like you have to do 2 years of senior residency, more than 500 bed, 1 year of senior residency, more than 500 bed, 1 year of senior residency. People have to do 1 year of senior residency to become assistant professors. Okay, so this is very, very important thing in the bed count. Even bed count.
Okay, thank you, Dr. Shweta.
Yeah, Dr. Sridhar, it was a very, very insightful discussion by Dr. Shweta. I appreciate her. Yeah, see, when you become a postgraduate resident, you have to work with your counterparts as well. You do have female co-PGs, you do have male co-PGs, and all. At the end, you are all doctors and you are all specialists. So always make sure you, whenever you going to select a college, talk to your immediate seniors. They are the best ones who can tell you how is the college. Okay, if you are unable to talk to them, we have the insights from them, like what and all the things and how it is, how is the accommodation, how is everything there, how is the environment, how far is the college from the city, and what is the feasibility there, and everything. So you can take our guidance as well. We will also let you know how is that place with the college of your choice. So that thing.
Thank you, Dr. Vasim.
Yes.
Now I would like to request Dr. Srikanth, whose background is from Maharashtra, and he is currently doing his residency in Karnataka, about the language and the financial support in supporting
Yeah.
the course.
Okay, thank you, Dr. Sridhar. The thing is, first Sarthak already told about his condition, what happened to him. Like he was from Rajasthan and he went to the Delhi, so he has not that much problem of the language and all. But as I am from Maharashtra and my main mother tongue is Marathi, okay, and I moved to the Karnataka, the Sulia, which is Mangalore part, which is near about the Kerala and Karnataka, in between that area. So their native main language is Kannada with the Tulu language. So it is very difficult to handle that main thing of the language thing. As he said, if you are doing the core branches like medicine, surgery, you have to take whole histories and all. So you should know that language. But the thing is, after all, the main thing is, like I have decided to take the seat in Mangalore. Why? Because I was getting the radiology. So I feel if you are getting your dream branch anywhere, so if you can adjust that thing of language and you can learn the language. Like I learned the Kannada in near about 3 to 4 months only. It will take 3 months, 4 months to adjust you, but you can take. Yes, that is the problem. Actually, that's the problem, but you will learn. because if you are getting a dream branch, you can adjust that thing. The main, as Dr. Sridhar was telling about the financial support, like I feel if you are choosing a private colleges, the first of all, the main thing of the all student is the budget, because there are many different states providing different budget section of the colleges. Like we have one slide like about that state wise private colleges list. Like in Karnataka, it is an open state. They Karnataka will provide we will give at they will around fee structure is around 12 to 14 lakhs. Okay, in Maharashtra, it is near about we are Maharashtra state is 8 to 16 lakh, but it is closed state, and UP is near about 20 to 25 lakh. So these are the annual fees you should know, and this is that is the financial thing you should know before the choosing the branch and all, because budget is also in one of the important thing to choose the branch. While to go from you are moving from your state to another state, I feel. That's the main
Thank
things.
you. Thank you, Dr. Srikanth. So now I would like to tell about an important thing of consideration while choosing the PG of choice, even in a different state or home state, about the spouse, the field and domain of the spouse. So I would request Dr. Abhinav Kachari sir, who is a consultant pediatrician from Pune, to say about the importance of family circle and how to plan in the future, because we are in the prime time, especially the choosing the post-graduation time and the work-life balance.
Yes, definitely there is some candidates have pressure from family to get married as soon as they opt for post graduation. So the role of the spouse is important. Whether the spouse is able to understand work-life balance, that emergency duties, 36-hour shifts, which the person doing PG will be enduring. So the time available for personal life will be vary from branch to branch. So if a partner who is able to understand your work situation, then it is good. So you will have family support also. They can provide emotional support, or they can bring food at times or some coffee and boost your energy while doing residency. So those aspects, emotional aspects, also play a vital role in completing your residency.
Okay, thank you, Dr. Abhinav sir. Now, finally, when we are discussing about the subcomponents, the practice location and what is the career we're going to have post PG is also a matter of significance. Now, I ask Dr. Wasim sir, who has a consultant surgeon in Tirupati and he has his own hospital in Andhra. Like, how did you plan, sir? Dr. Wasim sir, over to you.
Yeah, Dr. Sridhar. Hope I am audible. Yeah.
Yeah.
See, actually, uh, to be frank, initially from the days of my internship, I wanted to become a surgeon. To be frank, see, when I was doing my internship, when I was going into OT, I was scrubbing up. I was feeling that thing. Yeah, this is the thing I want to. So I always wanted to become a surgeon, and I wrote NEET PG, and then I got general surgery, and I did my general surgery from Mysore, and then later I worked in private medical colleges as well as an assistant professor, and I saw government hospitals also, and I worked in government hospitals also as a government civil surgeon. So the point is, the practice location is very important, because at the end, any student who is joining a postgraduate, even if he's going out of his state, so the first thing I would like to tell students is, see, if you are getting a very good college in your own state, pick it up. A government institute, a very good government institute in your own state, if it is not a central institute. So if it is central institute, you can go far. See, like how Dr. Sarthak, Dr. Srikanth, and all of them have gone places to join a very good institutes. So yes, you can go there. But if it's not a central institute, then I would tell you, select if you're getting something, select a very good government institute in your own state. So then, if it is very near to your hometown or the place where you are going to settle back, it is even a what is a cherry on the cake, because see, the circle you make, the patients you get, all will be from your locality or nearby your locality, and that will also give a very good boost into your further life. Okay, that's that I can tell. And regarding surgical, see, I have seen the chat box. Most of the students have been asking, sir, everyone is telling this branch is saturated, that branch is saturated, don't take that, don't take this. See, in a town, if you see, you can have n number of pediatricians, you will have n number of orthopedicians, you will have general surgeons, you have everyone. The tier 2 cities or tier 2 towns and all. Okay, even in cities you have a lot of specialists, but the point is everyone have their own practice. So no one is sitting empty without patients, so they have their own patient circle. So the building a patient circle, having patients, having your own patients, having see, for me, because I am from surgical background, a patient coming to you comes with a lot of trust. He must have already inquired about you, where you have studied and where you are working, and your past patients whom you have operated would have also given a feedback to them. They, after looking all those things, if the patient is going under anesthesia and getting a knife on him by you, he will be coming to you with a lot of trust. So to be frank, I would like to tell, responsibility comes first. So even if you're post graduation, you are learning something, you are talking with the patient, you are trying to see the patients. We should always try to learn from the patient. They are our best teachers. Okay, so we are learning from them. So if your practice location is a tier 2 city or tier 3 city, any medical specialty or surgical specialty, broad specialty, you will excel like anything. It depends on how you take your practice. You can have your own
Thank you.
setup, you can work in a corporate as a consultant as well, you can flourish like anything. There is nothing like saturated. Okay, there is
Thank you.
nothing like saturated. Over to you, Dr.
Thank you, Dr. Wasim. That was very hopeful. So, amidst of this time, we have discussed about multiple parameters while shortlisting the college. So, finally, if you want to say only 2 points as a golden points at the end of the counseling, what we have to try is that don't put choices that you are not aware of. It's not the number, it is the quality or how much awareness you have or connection with that choices matters. Then don't put the choices that you don't want to join, because it unnecessarily pulls the candidate from the round 1 to round 2 and even to the ambiguity into the state counseling and all India counseling, and it even blocks a seat for another deserved candidate, and you will be in a confusion and trouble. So these are the 2 golden points you'd like to present as a team, because the team of diverse domain we are having in our team. So considering this, don't put the choices that you are not aware of, and don't put the choices that you don't want to join.
And Dr. Sridhar, I want to add one important note here. According to MCC, and even though like most of the state counseling authority, last year they changed the rule. If you have been allotted a seat in stray round, and if you are not joining that seat, then you will be debarred for 1 year. Earlier it was 2 years, but later on they changed the rule. So especially round 1, all India round 1 and maximum state round 1 is a free exit. So no problem, but no need to fill those choices which you are not comfortable. Maybe some other candidate, whoever are interested for that subject, they can join. But everyone should remember that if you have been allotted a seat in stray vacancy, then you will be divided from next year 2025 admission process. So don't fill any choices in stray vacancy. And in maximum state or even though in maximum state counseling, if you have been allotted a seat in round 1 or round 2, then if you are not joining that seat, then you are divided from the further counseling. So that's why it's very important that if you are not interested for that subject, or if you think about those subjects earlier, then only fill those choices.
So I would like, sir, can I add something?
Yes, sir.
See, while filling the choices, you should think that if you get the seat, you will take the seat. Like each choice, you feel very seriously. If in the real life scenario, you should imagine that if you get the seat, are you willing to continue? Then only fill the seat, fill the choice particular. For the sake of filling choices, no need to fill the choice. Fill each choice carefully.
Yeah, Madhavji, can I add a point here?
Yes, sir.
Yeah, see, actually, like Dr. Abhinav has highlighted, every choice you put is very, very important, because in the initial part of the session today, I have told you the rank, the people who have got a bigger rank also landed up in very good places compared to the people who have got better rank. See, this is where the choice filling comes into a very, very important picture. So selection of choices, okay, selection of choices is very, very important. Always put a choice keeping in mind you where you want to join. That's it. See, if you are putting an option and locking it, it's like, yes, if I get this place, I am going to do my post graduation there. That's it. So that type of options you put, then you will have very, very better chances of getting a very good college. And rest regarding the guidance, we are here to help you, Madhavji, and we all team are here, so we will guide you properly about the choice filling and everything as well. So in the further sessions also we'll be discussing about that. I think, yeah, over to you, Dr. Sridhar.
Now, Madhav will explain about the one-to-one counseling and the services offered under the platform of NEET Predictor.
Yes. So this year, like one opportunity we are giving. See, there are like many like agencies or companies, and they are not guiding them properly, just for data and all. So forget about those things. Main thing is what, like, you need to clear all your doubts. Whatever, even I'm going through. I was replying for few chats in my WhatsApp and all. So I've seen maximum candidate, they are confused how to go ahead with this counseling process. So from beginning only, you have to be systematic, and we are arranging like even we are giving one-to-one session. Even you can book our session, whoever is available. Either you can book Dr. Sridhar, Dr. Sarthak, Dr. Wasim sir, Dr. Sayyad. You can book me as well. So whoever you are interested, you can take one-to-one counseling session, in which we'll be explaining, we'll be giving you complete details about your college possibilities, and we'll be helping you at making the strategy. So your idea will be clear later on, depending upon your rank and depending upon your branch and depending upon your uh, the place preference, you can shortlist the colleges and we can go ahead with the counseling process. For that, you must need to go to our website, that is www.neetpredictor.org, and you can book a slot, and immediately our technical team, they will be giving you a call back. And one more important thing, that uh, like whatever choices, as we told earlier, whatever choices you are going to fill here, that should be in proper way. So we do have data of all those institutes, how to fill the choices and which is the best suitable option for you. So in that Zoom meeting or video call meeting, we'll be giving you one session that is at very low cost, only $5.99. You can you can join that meeting, and you can book a slot for that meeting, and accordingly will be guiding you. And the best choice filling order will be made by from our team only. So up to you, Dr. Sridhar.
So thank you, Madhav. So we have the team of doctors on NEET Predictor, and there are two level of mapping, personalized mapping. One is the basic mapping and the advanced one. Based on the recent industry standards of looking into the parameters of stipend, bond details, bond making penalties, then infrastructure, then all India ranking, then even the women's safety, the colleges will be mapped according to their preferences, be it a single primary preference of a subject or a multiple subjects. So those model is also ready, and for the paid candidates, those models will be deployed to them. So thank you everyone for joining the session. We will keep the chat box live for another 10 minutes. On any other queries, you can drop in the chat box live, and you can anytime you can connect with the team. Have a great day.
In future, we are coming with lots of webinars, free live webinars. So if you like this webinar, then you can subscribe our channel for further updates. Apart from webinar, also we do have lots of recorded video, like related to bond, stipend, counseling rules and all. So even you can go through those videos, which are very helpful.
Thank you.
Yeah, I'd like to thank everyone so for this today's wonderful session. Thank you, Dr. Sridhar. Thank you, Madhaji, and thank you, Sarthak, Dr. Sarthak, Dr. Abhinav, Dr. Shweta, and Dr. Sami, yeah, and Dr. Shrikant. It was a very good session. And see, this will be there in the YouTube. So those who have missed the live, they can come back and they can again look into the slides, and you can even take screenshots. But importance of a proper guidance is what makes a huge difference. So once again, all the very best. Keep stay tuned to us. Thank you.